Welcome to Advanced Care Planning, What Matters? Thank you for attending this session. This is session 2 of a 3-part series. This presentation was originally developed by Carly Olson, DNP, with attribution to Nancy Joyner, a palliative care clinical nurse specialist, and has been adapted to a Synthesia AI presentation. Advanced Care Planning North Dakota, or ACP will be referenced throughout this presentation. This organization, formerly known as Honoring Choices North Dakota, was developed in June of 2013 and was established as a statewide initiative to improve advanced care planning across the state. The governing board is comprised of a multidisciplinary group of individuals from various professions and organizations across the state of North Dakota. ACP aims to teach community members how to create an effective advanced care plan. The objectives for this 3-part series on advanced care planning are to give an introduction to advanced care planning with terms and definitions, reflect on what matters in regard to medical decisions, and instruct on how to complete and share your plan. This is Part 2 and will focus on your personal values, beliefs, and medical preferences, as well as identifying a healthcare agent. It's essential to discuss your healthcare goals with loved ones and your provider, then document them. An advance directive ensures your care aligns with your wishes, especially in emergencies. Have you ever thought, we should probably get an advance directive or care plan in place before something happens? We'll do it next month once harvest is over, or maybe once the holidays are over. This thought process is very common. We wanted to bring some of these statistics to your attention. This data is a little old, as some of the references are from 2012 and 2013, but the current data is quite similar. Starting on the left side of the screen, 90% of people say that talking with their loved ones about end-of-life care is important, but only 27% have actually done it. 60% of people say that making sure their family is not burdened by tough decisions is extremely important, but 56% of them have not communicated their end-of-life wishes. And lastly, 82% of people say it's important to put their wishes in writing, but only 23% have actually done it. Advance directive completion rates are low nationwide. Completing one before a medical emergency ensures your wishes guide your care, rather than making rushed decisions in a crisis. Being proactive rather than reactive allows you to take control of your future care. Many delay this important step, assuming they'll do it later. Ideally, you'll never need it. But if you couldn't make decisions for yourself, wouldn't you want your wishes followed? Here's a short list of the advantages to advanced care planning. Reduces the chances of dying in the hospital. Decreases cost of care. Improves compliance of end-of-life wishes. Improves individual and family satisfaction with care. Reduces family stress. Reduces anxiety and depression. Improves end of life. Of note, advanced care planning has been associated with decreasing the cost of care, as it decreases the number of unwanted treatments and procedures, such as de-escalating care and not admitting a patient to the intensive care unit. A healthcare agent is an individual that you appoint to make your healthcare decisions for you if you're unable to communicate your medical preferences. The individual appointed as the healthcare agent only goes into effect when you lack the capacity to make your own decisions. However, in the state of North Dakota, you can note in your advance directive that your healthcare agent can also make decisions for you and with you, even if you are able to make your own decisions. Choosing a healthcare agent. Your healthcare agent will only make decisions if you become incapacitated. Here are some things to consider when choosing a healthcare agent. Must be 18 or older. Should be comfortable making decisions that align with your wishes, even in emergencies. Need to separate their feelings from yours and act in your best interest. Should be someone you trust and who respects your choices. Here are some examples of a healthcare agent. Parent, spouse, or partner, adult child or sibling. Friend, trusted neighbor, or member of a faith community. Your agent doesn't have to be a family member or live nearby, but they should be available when needed. Choose who you trust most, not just the assumed choice. We always think that we have time or we can do it later. A common saying that goes along with advanced care planning is that it always seems too early until it's too late. Barriers to advanced care planning. Lack of time. avoidance by both individuals and providers, no available proxy to make decisions, waiting for the other party to start the conversation, fear of burdening loved ones, delaying until a crisis occurs. Many hesitate due to time constraints, confusion about medical terms, or waiting for their provider to bring it up. Take the initiative. Ask about your medical conditions and how to complete an advance directive. Understanding the process is just as important as completing it. Discussions about advanced care planning aren't easy, and they often don't happen because no one takes the first step. Doctor visits usually focus on immediate needs, but you can bring up your future healthcare preferences anytime. You can even schedule an appointment specifically for advanced care planning. Medicare beneficiaries can use their annual wellness visit to create a personalized care plan, including advanced directives. Don't wait. Take the initiative at your next doctor's visit. Many people don't know where to start when they sit down to talk about advanced care planning. Start with what's important to you and what makes your life worth living. What makes you happy, what brings your life meaning, and what worries you. Think about how to communicate this to your healthcare provider. At the start of this session, advanced care planning was referred to as a process. This diagram is portraying how planning for your future care can change, but that having the goals of care discussion leads to treatment decisions. When healthcare professionals talk about goals of care, we are focusing on you. What are your goals for your care? In the event that you're in an emergency, do you want to receive all life-saving measures? Or do you simply want your spouse and your children notified of the situation and to be kept comfortable? If you are religious or spiritual, do you want your religious or spiritual leader notified? If you are admitted to the hospital, do you want to be a full code? If you want to die peacefully, you can have a DNR or do not resuscitate order in place. In the event that you are unable to make decisions for yourself, having an advance directive is one way to legally document your medical preferences, wishes, and desired treatments to help guide your care. Note that the conversations occur throughout this process. This is the most important part of this section, noting that this is not a one-and-done process. Families and caregivers should become comfortable talking about a person's wishes regularly, updating advance directives as applicable and assuring that conversations happen at each phase of life up until end-of-life planning. So how do you know what you really truly want? The Go Wish game was designed to specifically get you thinking about what is most important to you and what you want regarding your medical decisions. This is a game you can play with your loved ones to get the conversation started. For more information on advanced care planning, you can visit the Institute for Healthcare Improvement's Conversation Project. Here you can find state-specific resources, guides, a What Matters to Me workbook, and many other resources. Thank you for joining us for Part 2 of Advanced Care Planning. Reminder that further information can be found in the other parts of this series. Part 1, Introduction to Advanced Care Planning and Definitions. Part 3, Completing and Sharing Your Plan. You can also find us on our website at www.acpnd.org.